Welcome everyone to the second session of the Canadian Fall Prevention Virtual Conference. My name is Kara Zakavich and I am the Child Injury Prevention Program Coordinator at the Saskatchewan Prevention Institute. So this afternoon, I will be presenting on preventing childhood falls, and then Helene will follow up with a conversation around preventing childhood fall prevention, connecting the dots. So I would like to begin by acknowledging the land that I'm speaking to you from. I'm situated in Treaty 6 territory, the traditional territory of the Cree peoples, and the homeland of the Métis Nation. I pay respect to the First Nation and Métis ancestors of this place and reaffirm the importance of connection and relationships. I commit to building relationships with Aboriginal peoples and extending the reach of our efforts in both policy and practice. A couple of housekeeping items for today's session is that you are all muted, but please use the Q&A or the chat box to share your questions and comments. We have our IT team standing by to help you with any difficulties, so you can put your comments in the chat box and those will be addressed there. And at the end of the presentation today, a pop-up will come on your screen, so please stay on the line and answer those questions right in the pop-up chat box, and that will be open for about 5 to 10 minutes after the presentation is over. I have been with the Prevention Institute since 2002 and promote the importance of injury prevention. We develop injury prevention resources based on current best evidence for a variety of audiences, including professionals, parents, social, any type of professional. And we've been working on resource development, knowledge translation, facilitation, and planning professional development opportunities for about 40 years now. This year is the Institute's 40th anniversary. I have a Bachelor of Education from the University of Regina and an Early Childhood Development Diploma, and I have a love of lifelong learning. So I'm going to go ahead and share my screen here and get started. Here we go. All right. So this presentation was developed by the Child Injury Prevention Program at the Saskatchewan Prevention Institute. And if you're not familiar with the Prevention Institute, we are a provincial nonprofit organization that strives to reduce the occurrence of disabling conditions in children. Our slogan, "Our goal is healthy children," guides our work. The Child Injury Prevention Program works to raise awareness about injury risks and best practices to reduce the number of injury-related hospitalizations and deaths in children, and to decrease the risk of life-altering injury. Injuries remain a leading cause of death and disability for children in Canada. Saskatchewan has a particularly high rate of child injury. Taking preventative action is important for the health and well-being of all children. The focus of this presentation is on increasing the understanding about children's falls. And this particular presentation can be found on the Saskatchewan Prevention Institute website. The presentation was originally developed for community-based programs to use in their work with families to help prevent injuries. The presentation is of interest to public health, early childhood educators, daycare providers, and others that work with parents and children. On our website, skprevention.ca, there is a PDF of the slides, and speaker notes are available, and it is free for anyone to use. The first piece of information covered in the presentation are statistics from Saskatchewan. Falls are a leading cause of injury-related hospitalizations in Saskatchewan children and youth. Falls are of special concern because they are the most common cause of injury-related hospitalization and because serious injuries to the head and neck resulting from falls can be life altering. This presentation was developed based on best evidence from the Child and Youth Injury in Saskatchewan 2004 to 2013 report. The report is resource 4-007, and we have a summary on 4-009 on our website. So both, again, can be found on the Institute website. In the presentation that is on our website, there are statistics again, and for today's purpose, I didn't include those things. I just wanted to cover sort of the general trends and patterns and things that we learned from the report. So falls are the leading cause of injury-related hospitalizations for Saskatchewan children under the age of 10. And they accounted for about 45% of all injury-related hospitalizations. And the children that were most likely to be hospitalized due to a fall were males between the ages of 1 and 4 years. And falls from one level were responsible for almost half of all fall-related hospitalizations. When we were designing this particular presentation to provide to parents and caregivers, it was very important to include the where do the falls happen and describe this for what this looks like for parents and caregivers. It is very important for us to raise awareness and part of our education efforts. So falls from one level to another accounted for 38% of falls resulting in hospitalization. So what do we mean when we say falls from one level to another? This includes falls from beds, chairs, other furniture, falls from trees, falls from diving or jumping into water. And other types of falls include falls on stairs and steps, falls on the same level, so just standing and falling, and playground falls. And then falls on the same level would also include a child that's being carried. So this slide in the presentation was probably the most important for me to include based on my early childhood background. We need to help parents and caregivers understand what's going on in that early childhood period and why children are at risk for fall-related injuries. So their curiosity, their physical development, their problem-solving skills, the developmental milestones that they're achieving at that point, and supervision. These are all linked to the risks of falls. So in terms of curiosity, we know that children are naturally curious. They learn about the world around them by hearing, seeing, touching, smelling, tasting the things around them. And they may not understand the hazards that are around them and that they can be injured by something in their environment. So a young child may not understand that they can fall and hit their head if they climb on a furniture to get at something that interests them. Physical development. This must be considered when we're talking about fall-related injuries. Children are not just small adults. They differ from adults in many ways, and this puts them at risk for injury. So an example would be that their heads, young children's heads, are large and heavy compared to the rest of their body and compared to adults. So this larger head size puts them at risk for an increased risk for a fall. It also makes serious injuries from falls more possible. So between birth and age 4, children are undergoing significant changes in their growth and development. Their brain size, their bones, right? Their muscles, their cognitive development as well. And these changes may affect the type of injuries that they sustain. So their problem-solving skills, such as recognizing hazards, this can be difficult for young children because their brains have not been developed to the point to do so. Children need adults to help them problem solve and stay safe. So, for example, a child that is 4 years old may not be able to recognize that leaving his toys on the stairs is a tripping hazard. Developmental milestones. Injuries often happen when a child reaches a developmental milestone that the caregiver is unaware of or unprepared for, such as rolling over, standing up, learning to grab. So, by parents being educated and knowing what to expect, can help reduce the risk of a fall. Caregivers can adjust the environment or their own behavior to provide a safer environment. So, another example here would be a child who is 4 months old and not yet crawling, by the parents installing baby gates on stairs before the child can crawl is one way to be prepared ahead of time. And supervision. Injuries often happen when caregivers are not directly supervising children. Direct supervision means that a caregiver is within arm's reach and is watching what the child is doing. The younger or the more impulsive the child, the more important it is to stay close by and supervise to stop any behaviors that might result in an injury. Caregivers are generally in tuned to their children's skills and abilities, and they will know when it's a safe time to give that child more freedom. A child who is 3 years old requires very different supervision than a child who is 8. And supervision changes on depends on every child's individuality, their development, and their individual needs. We define hazard and risk in this presentation and introduce the concept of risky play. And Mariana did a fantastic job of talking about risky play, so I'm not going to go into detail in that for this presentation. But in the presentation online, we do have a couple of slides regarding risky play. So defining hazard and risk is important because it provides parents with the language that they need to guide their child's learning. And again, as Mariana said this morning, we don't want parents controlling children's play and their behaviors, but we want them to teach them to recognize the hazards as they grow and develop. And the word risk is often misused, and it is necessary to be clear about what specific hazards are and what the risks actually are. Sharing general injury prevention concepts and addressing what parents and caregivers believe is very important when we are doing education with a group of parents or caregivers. We want to address using the word accident and talk about the fact that injuries are predictable and preventable. And this will help promote injury prevention across Canada. Using an example of a young child falling out of a window, we then can introduce the concept of the Hayden's matrix. So we can ask some questions like, what happened before, what happened during, and what happened after? So before the event, maybe there was no lock on the window, and maybe there was no supervision. During the event, the child sustains a head or neck injury from the fall. What happens after the event? The child is taken to the hospital and receives treatment. The chair is then removed from that room, a lock is installed on the window, and more supervision is provided. To prevent childhood falls, there are effective tips that can be helpful. And we go through these tips in detail and provide lots of examples in the presentation that is online at the Saskatchewan Prevention Institute website. As with all child-related injuries, active adult supervision is a very important method of prevention. So we talk about things like using safety equipment, so including straps on strollers, high chairs, activity swings, using window guards, baby gates, etc. Making the area safe. So for example, keeping the entrance of a home clutter-free so that people aren't tripping on items and sustaining a fall. Teaching safety skills. So older children can be taught about safety behaviors and how to recognize hazards. And so, teaching a child to turn on the light before they go down the stairs. And setting a good example. We know that children learn from the adults around them, and caregivers can teach children a lot about preventing child injuries. And we know that children will imitate our actions. In the presentation online, we certainly promote the ALTER program because it is an evidence-based program, and it is an easy reminder for parents and definitely a concrete tool for people to use. So you can go to ALTER for Child Safety to see that tool if you haven't already done that. And the rest of the presentation online covers playground fall statistics and prevention tips. And for today's purpose, I'm not going to go into those tips or statistics, as you can download the presentation from the website for yourself. But it is important to share a couple of key things. So children aged 5 to 9 experience the highest percentage of playground falls resulting in hospitalization. So why this age group? So then we have conversations about what's going on developmentally for children between the ages of 5 and 9. They're becoming more independent, they're still developing physically, mentally, emotionally, socially. They're practicing their balance, their strength, their endurance. And we cannot expect children at this age to have motor competence on playgrounds. So we need to allow them to practice, we need them to do trial and error, we need them to process things as they learn skills. But, children can't be expected to take on safety themselves. They still need parents or caregivers in the vicinity for sure at this age. And we know that playgrounds are a place where injuries can happen. And as Mariana said this morning, what's the severity? So then when we're with a group of parents and we're doing some education, we'll talk about severity of injuries as well, right? Is it a fracture? Is it a scrape? Is it a cut? Is it a head injury, right? What's going on? And we know that falls from playground equipment often occur because children are growing and developing and discovering what their skills and limitations are. Playground-related hospitalizations, the most common body part that was injured from the Saskatchewan statistics was the upper extremity, and so fractures, basically. And certainly those are not as serious as head and neck injuries. Other important pieces when we're doing that education about preventing serious injuries from falls on playgrounds is to include conversations about things like using the Canadian Safety Association playground equipment standards, the importance of adequate adult supervision, and the type of playground equipment being used at the time of the injury. So to close today, for my portion of this presentation, before Helene gets into hers, I just wanted to share, this is a fall-related hospitalization summary fact sheet that is on the Prevention Institute website, and the resource number is 4-402. So if you go onto the Institute's website and in the search bar you type the resource number, this summary will come up. And this summary provides information about fall-related hospitalizations for Saskatchewan children under the age of 10 between 2004 and 2013. And there are fall prevention tips as well in this summary sheet. Again, we developed this presentation to support professionals in Saskatchewan sharing fall prevention information in prenatal and parenting education classes. And we particularly focused on hazards in the home. We feel that falls are often overlooked or not recognized as a contributor to injury, yet they remain a leading cause of injury. When I do safety presentations, I often receive feedback from parents that they were not aware of the significant or serious injuries from a fall. And this is in line with what Morangello found in her 2004 research, and that home safety measures related to falls were taken when relevant to their own child and viewing fall-related hazards as less of an issue, reflecting the belief that falls are normative during childhood. We continue to look at ways to help parents and caregivers better understand serious fall injury and its consequences in children. We believe that injury prevention is a collaborative effort, and anyone that can take a piece of this information and share it with parents and caregivers must do so. All right, so just before Helene goes on to present, I'll take a couple of questions while she's uploading hers. If there is anything, if you want to pop those in the Q&A or chat, and then I will let Helene go from there.
Just waiting for a few questions that you may get.
Yeah, you can go ahead and upload your presentation, Helene.
Okay. Can everybody see that? You can see that, Kara?
Yes.
Great, thank you. So my name is Hélène Gagné. I'm the program director at the Ontario Neurotrauma Foundation. Oh, I think you may have a question. Wait a minute.
Yeah, that's great.
How about I wait?
Yeah, sure.
You do that.
Sounds good. So the first question that I see is, are there any updated stats coming post 2013? I don't currently have plans to do another report, but that's not to say that we won't. And I know that there are statistics out there that we haven't accessed post 2013. And how long are the training sessions that can be offered? So the presentation that's on the Prevention Institute website, when I've presented it to a group of parents before, it takes about a half an hour to present the information, but more importantly, a good solid half an hour of conversation with the parents throughout the presentation as well. Okay. All right. Well, if there's time at the end of Helene's presentation, we can still continue this conversation, and that's kind of what this session was about, was starting the conversation as well. So Helene, go ahead, and I'm going to mute myself, and I'll just monitor the Q&A for you, and we'll go from there.
Thank you, Kara. And okay, so going back to my introduction, so I'm Hélène Gagné, Program Director at the Ontario Neurotrauma Foundation. And the Ontario Neurotrauma Foundation, our focus is to bring research into practice to prevent brain and spinal cord injuries to occur in the first place, and also to improve the quality of life of people living with those injuries. And Kara, when you mentioned that the Saskatchewan Prevention Institute is 40 years old this year, it prompted me to think that ONF, for short, is 20 years old this year. So we're a little baby compared to your organization, but we're pretty excited about that event. And I have a background in health promotion, cancer prevention, injury prevention. Strategies are often the same, the topic's different, and the stakeholders different. So today, what I want to talk to you about is childhood fall prevention, connecting the dots. And the specific focus for today is somewhat having of a common understanding of the Canadian context and capacity for childhood fall prevention, as well as the practitioner perspectives in doing their work, and what would be some collective actions that could be taken in that field, and what are some next steps. And those are done on the basis of 2 environmental scans, as well as a town hall after the scans, which I will be going through momentarily. But first, I want to highlight the work of the National Advisory Committee on Childhood Fall Prevention. And I know that some of you are in the session right now, so please say hi in the chat room because I know you're there, and Kara is definitely there. So that's a national group in nature, and it's been around for 2 years. And basically, we were looking at what are the issues in childhood fall prevention. I see that some people are saying hi. I have to check because I'm a curious person. So hi, Chantal. And I know Kathy's there, and I know Leanne is there, and just saying hi. So this group has been, initially what we were doing is looking at some of the initiatives that are already occurring, and like Luke Jr. and Fall Prevention Month, and the organizations like Saskatchewan Prevention Institute that's been around for quite a while, same with Child Safety Link, and all these organizations that we knew of, but we felt that we didn't know everything that was occurring in childhood fall prevention and having many gaps in our knowledge. And so we thought, how about having an environmental scan to look at who's doing what across Canada? So the first scan was done in March 2019. And the focus was definitely just looking at the resources, looking at the evidence-informed best practices around, and what could we do together. We were hoping that these would highlight some gaps, highlight some issues, and possibly things that we could do together. So ONF sponsored that first scan, and you can find it on the link there, which I think this, if I'm correct, all the slides from these sessions will be available later on. So what did the first scan focus on? So basically the first scan, we looked at the nature and scope of the issue in terms of fall-related injuries in children, and also what are the risk factors as described, some of them by Kara earlier, and what are the practices and the programs and the environmental supports and the regulatory measures that are around that we know of across Canada or per province. And we also thought that it was important to highlight, as it was discussed today at noon by Dr. Brusoni and what was mentioned by Kara, the concept of risky play and other concepts that have been heard in the context of childhood fall prevention. And we thought that it was important to take that and take a look at it and what we know about it. And finally, the whole idea was to have somewhat of a sense of who's out there doing childhood fall prevention across Canada. And we did come up with a list of organizations, and possibly we wanted to have a bit of a sense of what could be done and some of the recommendations moving forward. So that was the first scan. So I'm not gonna highlight too much of that scan because it was March 2019 and we're already in 2020, and we know 2020 is enough said about that, but I can say that the second scan was done in March 2020, which already tells you that the world changed after March. But prior to that, we thought, okay, let's revisit the first scan and see what else has occurred in the last year. This was an opportunity to update the resources that we knew of in the first scan. But in this case, what we wanted to know was what's going on? How come we don't know as much as we think we should know? And what are the practitioners' realities when it comes to childhood fall prevention? So we thought that we would go further by interviewing some key stakeholders in the field and ask them a few questions about their work, their challenges, and what they're doing, and what are some of the practical issues that they're facing. So just to give you a quick highlight of the method, there were 21 interviews with 23 key informants across Canada. It was open-ended, semi-structured questionnaires, 7 questions, and the disciplines varied from health promoters to coordinators to specifically injury prevention specialists, policy consultants, trauma coordinators, researchers, data experts, and agency planners. So as you can see, it was a variety of disciplines. So what I'm going to highlight some of the findings of the scan because we were hoping to see what was going on and give us some ideas of action, which I'll highlight a little bit later. So the findings were in 5 specific categories, and which I will go through one by one. So the first category is differences between falls in older adults and children. the silos issue, which is nothing new in our field, balancing risk and play. What does that mean? Vulnerable populations came up a fair bit, and addressing practical challenges. So the first finding, so when we say differences between falls in older adults and children, well, definitely it's no surprise. We know that falls in older adult has been getting a little bit more airtime than children falls, and that the issue has been particularly in this year getting some highlight that we may not see in the childhood falls. The degree of falls as well is somewhat questioned at times, because people say, well, you know, children falls, it's part of the developmental stages, so sometimes it doesn't get the airtime it should, but sometimes it's also about, should we be discussing the level of injury that children are getting? And of course, to no surprise, there's a competition for resources, and we weren't quite surprised to see that finding. And also that in some cases, people were letting us know that childhood fall prevention does not necessarily fit in a specific spot in a field. Sometimes it's part of a broader context, injury prevention, children's safety. So it's not an easy fit. And of course, the issue of silos came up a fair bit, and various levels of silos. So okay, so I'll get Kara to say that word. I can't say it. Kara, come on.
Jurisdictional.
Thank you. Here comes a francophone. So in that area, so we know that it's a piecemeal approach often enough, and that it's create issues in connecting those dots particularly. And some organizations have different mandates, and they don't always align, and they don't always know about each other's mandate, may it be in health authorities, hospitals, and it just doesn't particularly connect around that issue of childhood fall prevention. And the age-old issue of a bit of a disconnect between public health and the health system as we know it, particularly hospitals. And also the respondents mention that there is the issue of balancing risk and play. And I'm not going to go in details, as well as Kara mentioned, Mariana Bersoni did a great job. But what people did acknowledge is that, yes, risk and play and risky play, but there are so many terms that come up and different concepts, physical literacy, and sometimes it brings a bit of confusion of which angle you're coming at. So they were highlighting that issue of something that we might need to consider in moving forward in this field. And also the need to parenting. So we know, as Kara mentioned, the need for supervision, but what is the balance between teaching the children to take risks, calculated risk, and particularly in having a healthy child development? So those tensions are somewhat there a little bit, so that came up in the scan. And some practical challenges around playground standards. In some cases, people think they're too rigid, they don't allow the children to play, and there might have to be a conversation again to address all those challenges in silos. Interestingly enough, the issue of vulnerable populations came up. And in that case, what the respondents were saying is that we know that we want to talk about childhood fall prevention, but in many communities, the issues are much broader. And it's about community safety, and it has to locate falls within that broader context, because as we know, all communities are not created equal when it comes to safety, and then when it comes to preventing falls, because there are some structured vulnerabilities already in those communities. So there's a need to build trust with vulnerable populations and utilizing different approaches that may not have been done in the past. And finally, the part of the finding was we need to address practical challenges. For instance, we should be thinking about implementing social policies that address local community context. And to that effect, I want to attract your attention to an interesting webinar that will occur next week under Loop Junior, which is an online platform for childhood fall prevention. And I believe that some of the speakers are there. I heard Chantal, and I think Jennifer is there. And it's going to be on social policies in the Atlantic provinces. So you may want to attend that. And so that's certainly an angle to look at in the future when thinking of childhood falls. And we definitely need to think of stakeholders in other contexts that we should connect with, and particularly around active living, because we know that's something to promote with childhood fall prevention. Physical activity is a bit of a protector factor. So we should broaden the scope. And of course, in some cases, because of the silos, we should, yes, focus on formal collaborations, but also informal collaborations, because just to make sure that the gaps are filled, and to keep in mind that there are changing system landscapes and structures there that, particularly in 2020, that's something that we certainly have discovered. And as I mentioned earlier, some respondents were saying, well, I do work in fall prevention for children, but I don't necessarily identify myself like that. It just happened to be part of my work. Sometimes it's on the side of my desk. And in other cases, I don't even know who else identifies as such, so I can find them and work with them. So it's an added difficulty that we have to take into account. And of course, another challenge to address is sufficient resources and who will prioritize the childhood fall prevention. And of course, making the information culturally relevant is of great importance. So out of that scan came some recommendations to move forward. The first one is, to no surprise, on the basis I've just told you of the findings, is that people say maybe we should take a broader approach, because childhood fall prevention, that's important, but it is set in a broader context. So maybe it should be child safety and any other concept that would make fall prevention resonate for children. And also bring different schools of thought, so that there's, to reduce a little bit the confusion around all the concepts that we've heard of, risky play, and also between helicopter parenting and the restrictive standards and the proponents of unstructured, risky, active outdoor play. What does that mean in practice? What does that look like? And should we have a conversation around that, that it's understandable to all? And of course, definitely breaking down the silos and looking into that, and where childhood fall prevention fits. So trying to find ways that we can connect those dots and work together. And that's certainly a recommendation that came up. And also people say, well, is it because, you know, child development, people say, well, you know, children fall. Should we be talking about the serious falls instead of all falls? Because some falls are not necessarily serious. So should the focus be on that? Should there be a conversation about that moving forward? So again, I'm not giving necessarily answers, but rather with the issues that came up. And also looking at, again, it comes to the first recommendation a little bit, like looking at childhood fall prevention in a more holistic way. And across jurisdictions. So it is the need to come back to a broader approach to childhood falls. And of course, there was a concept, someone mentioned the data. So in some cases, if the data is not there, or it's partial data, people will focus on bits and pieces, and that's what the media will pick up. It's not necessarily always complete. So certainly it's something that we know a few initiatives are currently on the way at the moment. I believe that the Public Health Agency of Canada is looking into the CHIRP data and looking at falls. And there's also York University and Public Health Ontario that's looking at falls indicators in childhood. So there are things on the way. It may be just a matter of aligning that work. And finally, looking at the concept of community safety as a whole, particularly as it pertains to newcomers, immigrants, and refugee children. Sorry. So when we saw that scan as a committee, we thought, wow, that's fantastic information. This is great. What do we do? It was not really obvious the things that we should be doing from there. So we thought, let's have a town hall. And that town hall took place on September 23rd. There were about 30 participants from across Canada, and we asked them 4 questions. And we say, what do you think needs to happen for this work to gain greater visibility and importance? What opportunities for collective action come to mind, and who should be involved? What questions about preventing childhood falls do you have? What can we follow up with? And also we wanted to know what opportunities are there to share information. Just have a sip of water. Thank you. Okay, these are what the themes of all the answers that were given to us during the town hall. So people said, yeah, they did validate the results of the scan, and they said, we need to redefine childhood falls. And what does that mean? So definitely a definition of falls and situating childhood fall prevention under the broader injury prevention umbrella, or any umbrella that makes sense. Bridging existing silos by connecting childhood falls to concussions, active living. There are many initiatives going on at the moment. It's just a matter of connecting everything together. And preventing serious injuries from falls, or do we focus on all falls or just the serious falls? So that came up as a theme. The second theme was branding. So are there common messages across Canada? Should there be messages across Canada around childhood fall prevention? And if not, let's look into that and let's make sure they're out there. Maybe we need to have a national media campaign, particularly inclusive of newcomers, immigrant and refugee children, to reduce the pressure on local resources. Not everybody has the capacity to do that. And the third theme was around the issues of knowledge, information, and skills needed. So of course, the data came up, as I mentioned, and there are some initiatives on the go right now around that. The issue of national standards and best practice programs. So in some cases, there aren't too many, it seems, best practice programs out there. Kara mentioned two already, hers and Alter. But what else is out there? And is there something to be done around best practice program? And who are the stakeholders? And how can we connect better? How can we make sure that we can chat about childhood fall prevention? And of course, the question of effective communication and language used, it should be something that we have an understanding around, the prevention strategies, which ones to use, and engagement strategies with stakeholders across sectors. One of the questions that we did ask as well, and that was a theme that came up, was what is it we currently have and the opportunities? So I'm just showing you here quite a few things that were mentioned by people, like you can see right now, the one around the conference that's taking place right now. So that's definitely an opportunity that people thought that we should discuss and make sure that we can work together post-conference. Luke Jr., of course, the Prevent Child Injury website, social media, the CHIRP data, which is the Canadian Hospital Injury Reporting and Prevention Program, the Child Safety Link website, the Cost of Injury in Canada report that's coming up from Parachute in 2021, the environmental scan of false indicators that from York University that's going to be coming out as well. Many other programs were mentioned like that in the scan. So now that we have this information from the town hall, we thought, okay, so now what? So we have this National Advisory Committee on Childhood Fall Prevention, and we said, okay, we're willing to take this on to help being a central convener and leader for the next steps. And one of which is, sorry, we're ready to look into coordinating the work around data and indicators. So we'll be making sure that that's happening. And we're looking into the childhood fall prevention messaging. Some of the members are interested in that. And so there might be some, sorry about that. There might be some places, like we may need to have some working groups. So I'm saying that to all of you, because if you're interested, let us know. We will be looking for some help in getting some work done, particularly around key messages. And also looking at other topics that would need to be included moving forward. So how can we talk about preventing falls in children in connection to what we know about deconditioning that's occurring during the pandemic, child safety, social policy. So that's where we're at. at the moment. And other than me coughing a fair bit, any questions?
So as of right now, there's no questions in the chat box or the Q&A, so I'll let folks take some moments to put those in. I just wanted to comment that when you were talking about active living and promoting health, that falls in line with what Mariana also said this morning, right?
Oh.
That our goal is not to maybe prevent, but to promote health and active living and all of that. So it was really interesting that that came up. So I think there's a great opportunity for those working in health promotion, active living, to join us in that conversation on how we can do that.
Yeah, and I just saw too that Shamiza posted the link to the Social Policies in Atlantic Canada webinar coming up next week in the chat room. Thank you, Shamiza. So there's a question, how will you go around getting people more involved in the conversation? So that's definitely a good question, and that's going to be a question for the committee. We certainly have the opportunity, because we have cross Canada committee representation, so that's a good start, but we may have to look into some of the steps towards the work that we can be doing around key messaging and other follow-ups to the scan, and come back to having webinars, conversations with people and getting some of your input back. And also looking into maybe having working groups on specific issues. So we don't have all the answers, so we're definitely counting on everybody's participation. And we also have Loop Junior, where the conversations are ongoing on various issues. So we hope that we are greater in numbers moving forward. Is there any breakdown in rural versus urban data? So that will be definitely, I don't have the answer to that, but I will tell you that for the data project that I know from York University that's funded by my organization, it's mostly focusing on what are the indicators for children falls. So, and what are the current indicators are being used across Canada, but also what should be the indicators are being used across Canada. And in some cases, it's also developing a wish list of indicators, because sometimes we know that the indicators we have don't always tell the full story. So that's what their project will be a part of. And that's going to be done, I want to say, in March 2022.
So Chantel just put a comment in the chat box that there's much more conversation happening now, and I would agree with that. And the work is very encouraging, and as Mariana said this morning too, to take that broader approach, and we found that in our findings as well from the town hall. So we look forward to working with all of you across Canada to find those opportunities to take that broader approach, for sure.
Stop sharing my screen so that it's easier.
Perfect.
Any other questions? Comments? Comments are good too. Are there suggestions that you have? Maybe I have questions for you, because here we are presenting some content, but from your experience, do you see that there are particular things that should be considered, that should be done, particularly that you want to send the message to the National Advisory Committee, because we will be reconvening after this presentation, and also after we reconvene already after the town hall, but it'd be good to hear what you have to say. I did put you on the spot, did I not? Maybe I have a question and maybe a yes or no in the chat room. So do you think if the National Advisory Committee were to organize another follow-up, maybe webinar discussion on this topic, would this be of interest to you? Would this be something that you would like to join and that you would like to see something specific happening?
Okay, so a couple of comments here. So having licensing involved for sure.
Okay.
Childcare practices and childcare facilities. Okay, great. And that we don't get the airtime that Seniors Falls gets, as you mentioned. Yes. Yeah. So, you know, how do we gain that greater visibility? That was one of our key questions that we discussed at that town hall. And so, you know, continuing that and getting different perspectives from the different sectors there would be great. And we've got a few yeses that people are interested.
Yep.
So, you know, certainly follow Loop Junior because that platform is where the conversation can continue online. But also, you know, if you are interested, you can send Helene or myself an email. You know, we're all on social media, so get in touch with us. We'd love to chat with you. And, you know, as soon as we have something planned or are in the plans to make the next conversation happen, webinar type, we will certainly involve you and get your perspective and your expertise, that's for sure.
I think there was a specific from Lindsay. I'm really hoping that the research around indicators highlights the importance of urban larger area versus rural northern smaller communities. Sometimes it is really hard to find evidence or programming that supports our work in smaller areas. Definitely, and that would, if it's not available, it should definitely be in the wish list of indicators because, and even as we heard from the scan, vulnerable population as well. We don't seem to have that kind of a lens, or when we do have the lens, the focus should be different than what we traditionally have been doing. Oh, I like this one. Data on injuries with long-term consequences, and particularly brain injury, would be useful. Yes, definitely. That's something of great interest to us at the foundation. So yes, most definitely is a great suggestion.
And Marguerite commented that she likes the idea of safer playgrounds. If a child falls from a swing onto softer material, the fracture is less likely. Is work being done on other playground equipment? And how is the committee's relationship with these designers and engineers? So I know that there was some adaptations to the Canadian playground standards recently. We have, as a committee, haven't engaged in conversation with engineers and designers at this point, but certainly they are on the list of sectors that we can get in touch with for sure.
Huh?
Notes here.
I don't see any other questions, so I'll leave it to you, Kara, to close it. I think you have a few things to say.
Just writing down a note here just to make sure we don't miss this stuff.
Oh, for which part? The chat room?
Yeah.
You know what? I think I can cut and paste, or
Perfect.
should I be asking Parachute? Are you keeping the chat room somewhere?
Perfect. Okay. So you will see in a few minutes the pop-up of the survey. So if you could provide your feedback, and we'll leave that open for 5 to 10 minutes so that you have some time to provide your feedback. And this concludes the today's session. And again, I want to thank our sponsors, Brown Healthcare, the home of the Hip Saver Canada, the exclusive Canadian distributor of the world's leading hip protector, for their generous support of the virtual conference, as well as our bronze sponsors, ONF, Saskatchewan Prevention Institute, and SGI Canada. And we thank you for joining in on this session today. And again, there are sessions daily this week, 12 noon Eastern and 3 p.m. Eastern through Friday. So please join in on as many sessions as you can this week.